Jason Shepard is a 3-day-old boy. His chief complaint is jaundice. His history of presenting illness is as follows. Jason was born 3 days ago. He was discharged at 28 hours. At discharge, he was noted to be mildly jaundiced. Level was not taken before discharge. The public health nurse came to the family's home at 52 hours. At that time, Jason was noted to be sleepy and quite jaundiced. She sent Jason to the pediatric emergency department for urgent assessment of hyperbilirubinemia. Prenatal history was unremarkable. Jason's mother, Alice, is 32 years old. This is her first child and her first pregnancy, G1P1A0. Alice was followed by a doctor during her pregnancy. There were no medical concerns during the pregnancy, and her screening tests were normal. She did not use alcohol, cigarettes, or street drugs during the pregnancy. She did not take any medications during the pregnancy. Alice's past medical history is non-contributory. There is no family history of significant childhood disease or jaundice. Her blood type is O negative. Jason was born by spontaneous vaginal delivery at 38 weeks, 2 days gestation. There were no concerns with the delivery. The labor lasted 8 hours. His APGAR score was 8 at 1 minute and 9 at 5 minutes. His birth weight was 3,300 grams, 25th to 50th percentile. No bruising was noted at delivery. Since birth, the parents have not had any major concerns. They thought that Jason had been a bit sleepy today, but they weren't sure whether this was normal. Jason is breastfeeding exclusively. The breastfeeding was assessed as okay while in hospital. Jason is feeding every 4 hours and about 6 times yesterday. Each feed lasts approximately 10 minutes. His parents report some rhythmic sucking and swallowing as he feeds, but think he may not be getting enough milk. Yesterday, he had 6 wet diapers and 2 stools. Past medical history, none, no surgeries. Family history, no family history of serious childhood disease. No family history of G6PD deficiency. Both Jason's parents are of Caucasian ancestry. Social history, pleasant but concerned parents. Meds, none. Allergies, none. Immunizations, none yet received. A physical exam was performed and is as follows. General appearance, lethargic neonate with marked jaundice. Vitals, heart rate 170, resp rate 42, temp 36.9 Celsius, blood pressure 65/45, length 48 centimeters. Weight 3,000 grams, head circumference 34.5. Positive for scleral icterus, anterior fontanelle slightly sunken, mouth slightly dry. No cervical lymphadenopathy. Cardio exam normal S1, S2. No murmurs appreciated. Good femoral and brachial pulses bilaterally. Capillary refill of 3 seconds. RESP, chest clear to auscultation. Good air entry bilaterally. Abdomen soft, no organomegaly. No masses. Neuro exam normal but lethargic. Cry is weak but not high-pitched. Tone is normal when awakened for exam. Suck reflex, Moro reflex, rooting reflex, palmar grasp, and traction response present. Derm exam. Markedly jaundiced, no rashes, no bruises, no significant cephalohematoma. Lab results are as follows. Total serum bilirubin, 302 micromoles per liter. Blood type A negative. Direct antibody testing negative. CBC with smear, normal for age with no evidence of hemolysis seen. Given the lab work and exam, you ordered a fractionated bilirubin level before initiating therapy. The lab results confirmed that this was a case of unconjugated hyperbilirubinemia. Given Jason's gestational age and lack of some significant risk factors, e.g. hemolytic disease, G6PD deficiency, you decide that he fits in the lower risk category. However, your preceptor reminds you that Jason is lethargic, meaning that he fits into the medium risk category. Given his total serum bilirubin level, therapy is indicated.